As you know, February is American Heart Month, so today we're going to learn about what we can do to determine our own risk of heart disease and some lifestyle changes we can make to lower our chances. Here with everything you need to know is Chief Medical Officer of WebMD, Dr. John Whyte.
Hey there.
Hello. We've used WebMD to diagnose ourselves with all sorts of terrible things. WebMD should be used as a tool more to find out what's good with our health, more so than diagnosing ourselves.
That's exactly right. And it's really meant to empower you with information, because better information is going to lead to better health.
That's right.
All right, well, start with some of the risk factors that we should know about.
Age is a big risk factor. Men typically in their 50s, women in their 60s.
Okay.
You know, too much sitting. We're all sitting way too much.
Yes.
And, you know, in front of the screen.
Smoking, yeah.
That's exactly right. It is a poor diet. That is a major risk factor. Smoking, 19% Americans still smoke. And there are some things like in terms of rheumatoid arthritis and gout that people may not know, that actually increases your risk of heart disease.
Gout.
Gout.
Okay.
And the reason why this is so important is women are twice as likely to die from a heart attack than men are, even though men have more heart attacks.
So yeah, that's a group that's more at risk. Any other groups as well?
People of color, 30% more likely to have heart disease. That's why it's so important to take control and reduce your risk.
And to take in control, what tests should we take?
You know, we used to think it was just an EKG and a stress test, but we know that's not enough. People really need to be thinking about this coronary calcium score. And it's not a calcium test that is in your blood test that you might see, but a special CT scan. And as we can see on the graphic, it will show you, based on your number, the amount of plaque you might have. So 0 is great. If you have a score of 0, I'm happy. I wish I had a score of 0, as I told you, mine isn't. Most people are around 100 or 200. If you're 200, 300, 400, that's going to impact what I prescribe for you as a doctor.
Is this kind of test covered by health insurance?
You know, I have to tell you, Kelly, sadly, a lot of insurance doesn't cover it. I mean, this is not a new test. It's better, but it could cost, you know, a couple $100s or so.
But that's ridiculous. That should be covered by medical insurance. I'm not sure why I'm looking directly into the camera, but maybe somebody is
listening.
Watching.
Because this is important information to stratify your risk.
Should we be concerned about the radiation exposure from the CT scan?
No, there is radiation, but everything is about risk versus benefit. And the information that you're going to get from this, which is personalized to you, it's going to show me your blood vessel plaque. That's going to help you live longer.
Will a doctor prescribe getting this kind of test or suggest getting this kind of test if there are like underlying conditions, a family history, that sort of thing?
And those are, if you have a family history of heart disease or an early family history, you have chest pain that really is atypical, then you need to talk to your doctor about this, and you should ask your doctor about it. A lot of doctors aren't recommending it. Absolutely.
Are there any other types of tests that we should know about?
So if you have a high calcium score, that 300, 400, you might want a CT angiogram. So we know that cardiac cath where they put a catheter in your groin or your wrist and inject
that doesn't sound like fun.
That has a lot of risk. But now we can do a CT scan to look at each blood vessel. And that's why that's so useful.
And how often should a person take that kind of test?
That test is really only when you have kind of these unusual symptoms or they're not sure. A calcium score might be every 3 to 5 years. CT angio, maybe something like that.
Okay, got it.
How about online resources that we can use to test what we, you know, what
if people don't, this is, assuming cost prohibitive, what if somebody can't afford an extra out-of-pocket expense?
It's all about empowering people with good information. So there's a risk calculator that the American Heart Association put out called Prevent.
Okay.
And you can put in different numbers, your blood pressure, your renal function, all those cholesterol
that you
panels.
get on your...
That's right. You plug those in, and that's going to tell you your 10-year and 30-year risk of having a heart attack. Enough doctors aren't doing this. You can do it yourself, And that's going to give you useful information.
Why aren't the doctors doing this, though? I mean,
Yeah,
why?
there's a lot to go on during the visit, right? And the
Okay.
Yeah.
visits,
Yeah.
you know,
What are some
quick.
lifestyle changes that we can make now?
Yeah. You know, we always know about, you know, healthy eating and exercising. What I've been telling people in terms of exercise, because you can hear 150 minutes of exercise a week. That sounds like a lot, 10,000 steps. People get frustrated, so they do nothing.
Right.
So instead I say, start at 2,000, start at, you know, 4,000, and then slowly work up. Exercise smarter, not longer. You know, stop eating after 7 p.m. You know, instead of thinking about, do I do keto, do I do paleo, do I do Mediterranean, just stop eating after 7 p.m. and you will lose weight.
But doctor, food tastes better after 7.
Hey,
That's
thank
true.
you. This is really, really important. For more information, make sure to pick up a copy of Dr. Whyte's book, Take Control of Your Heart Disease Risk.